So Klay Thompson injured his left knee last night in the game between the Toronto Raptors and Golden State Warriors. He was going up for a goal, landed directly onto his left knee, had immediate pain, was taken to the locker room, eventually brought back out to shoot 2 free throws, and then he eventually left the game. In this video today, I'm going to be talking about Klay Thompson's injury, which was found to have an ACL tear, and what we as orthopedic surgeons would do for this type of injury. What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. All right, so last night in the game, Toronto Raptors, Golden State Warriors, Klay Thompson tore his ACL. So I'm going to talk about a little bit about the ACL, but first, there are 4 different main kind of ligaments that keep the knee stable. This is a little model of the knee here. This is the outside of the knee. This is your bone called your fibula. This is your tibia. This is your femur up here. This is the medial portion of your knee. So 4 main ligaments that keep your knee stable. The first one is your LCL, or your lateral collateral ligament. The next one is your MCL, or your medial collateral ligament. The 2 that are inside your knee is your ACL, which is here. Anterior cruciate ligament. Cruciate just means crossing. And then your PCL, your posterior cruciate ligament. So these ligaments keep the knee stable. So when you're running, when you're walking, when you're going up and down stairs, when you're doing high impact activity, you can have an injury to one or all of these ligaments. When there is a knee dislocation, which means the tibia and the femur are disconnected, say for instance this here, that can tear either 2, 3, or even all of these ligaments here that keep the knee stable. When there is a ACL tear, which is the anterior cruciate ligament in the front of the knee, this keeps your tibia from sliding forward. That usually occurs what we refer to as a non-contact injury. The patient or the player is running down the field or running down the court and no one touches them. They just have a pivoting injury to their knee where that ligament there kind of tears, the tibia slides forward, and then there is a tear of that ligament essentially. When either of these ligaments fail, the LCL, the MCL, ACL, or PCL, the knee is considered unstable. A lot of the injuries of the PCL, or some of the injuries of the PCL, can be treated without surgery. But if there's an injury to the ACL, and for most patients, especially a high-level athlete, we would generally recommend reconstructing that ligament. ACL reconstruction is a very common procedure done by orthopedics. This procedure can be done arthroscopically, which means through a very small incisions and then a camera, and using a screen where we look at the images on the inside of the knee. There are lots of different types of grafts that you can use. You can take your patellar tendon, which is here, and use that to reconstruct the ACL. Some people use the quad tendon. You can use allograft, which is tissue from a cadaver that has been processed and sterilized. A couple different options you can use for ACL reconstruction. So it depends on the surgeon's preference as well as the patient's characteristics, whether they kneel a lot on their knees, how young they are, how old they are, and also the collaboration between the surgeon and the patient. So the ACL reconstruction surgery usually takes, hour and a half, 2 hours. After the surgery, the patient will go through some extensive rehab, and then the rehab usually can range anywhere between 6 to 9 months, depending on the therapist and also how well the patient does. So Klay Thompson tore his ACL. This ligament right here in the front of the knee needs to be reconstructed. I imagine he will go surgery in the next day or so, and then start rehab. So we probably won't see him back on the court for another, 6 to 9 months. That sucks for the Golden State Warriors because Kevin Durant will be out for that kind of period of time as well. But I wish Klay Thompson a speedy recovery. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.